to welcome everyone to this collaboration to overcome international internal parasite resistance. This has been a combined effort of Hamish Best of New Zealand, Isaac Matchett of the USA, Jeff Campbell of Canada, and Edward Brandt of the UK. Next slide, please.
My name's Ed. My name's Ed Brandt, and I'm from Lincolnshire in the UK. I farm there, a mixed farm with my parents, and we have cropping, beef, and sheep. And as part of the sheep flocks, got 2 performance recorded flocks where we're selling maternal rams and terminal rams from that.
My name is Isaac Matchett. I'm from the USA. We farm in Charlevoix, Michigan. We raise polypace sheep. They are a maternal prolific breed with the capacity to lamb out a season. We lamb spring and fall in a closely monitored pasture lambing system. Post-weaning, our lambs are finished in confinement on grain-based diets.
I'm Jeff Campbell from Prince Edward Island, Canada. My wife and I raise Rideau Arcot sheep. It's a Canadian native breed in an indoor accelerated system, as well as Charlet terminals. Outside the sheep, we also have strawberries, and I'm the Dairy and Livestock Development Officer for the province of Prince Edward Island.
And my name's Hamish Best. I'm from New Zealand. I'm farming some hill country sheep and beef land here with basically Romtex ewes and a terminal Suftex sire. So today we're just going to talk about effectively drench resistance and what the current situation is across all of our different countries. We're going to go country by country and just give you the current status of drench resistance, what each country is doing really well, and then also I guess what we're doing not so well and the opportunities that presents. Then Ed will give you a wrap up and basically a summary of our, I guess, key findings and where we go from here. But initially, I'm just going to run through what drench resistance is. So drench resistance is what we're defining as when the correct dose of an antibiotic is given to a population of sheep, when this correct dose results in less than 95% of the parasite population being controlled. Why is that a problem? Basically, we're all making money out of sheep production, and when drench resistance becomes a problem, we're having massive production losses. A lot of the main problem of this is that sometimes drench resistance can sneak into farms, and we don't realize that it's drench resistance that's causing the problem, because it can take a while to build up into sort of clinical effects. It's costing the industry a lot of money, but also it has a massive effect on animal welfare and reduces our efficiency, which in the same breath increases the carbon footprint of our glorious protein. So in New Zealand, the current status for out of most of the literature that's being presented at the moment, we've got about 27 to 34% of tested flocks showing to have triple drench resistance. I sort of have to imply that that's tested flocks. I'd say there's a lot of farms out there that don't know, and that's probably our biggest problem as Kiwi farmers. We don't know what we don't know, and so it's hard to, I guess, overcome this problem when there's so many farms across New Zealand that don't know their current drench status. So that's the biggest one, I guess, for us. We do have other drenches like StarTect or Zolvix available, but as single actives, they're becoming more resistant. New Zealand, what are we doing well? Well, we do have some things up our sleeve, such as most of our sheep farms are mixed species. So we have a lot of cattle, which we can use for refugia. A lot of the sheep breeding farms can use their mature sheep to help fight resistance. and we're doing that quite well. We do have all of the, I guess, most up to speed drugs available to us, but we're also, because most of New Zealand farms are forage based, that is a risk, but we are using forage crops and novel swords such as lucerne and forage brassicas to help this. Can someone who's making noise just mute their microphone, please? Thanks. And I guess for us, what are our biggest opportunities? I think for New Zealand, from what we've seen, what we really need to do is do more testing. From a farmer's perspective, it does cost. We do have probably access problems with doing worm tests. So making fecal egg counts easier and more cost effective will help improve that. That's probably our biggest opportunity. But I guess there is ways to manage to get out of drench resistance outside of drenches. So I'll pass over to Isaac, and he'll take you through the US.
Thank you, Hamish. In the US, Haemonchus contortus, commonly known as barber pole worm, is the primary parasite risk in all regions, with the exception of the Intermountain West. The Intermountain West has a slightly less pressure due to lower stocking rates and a cold, dry climate for parts of the year. Additionally, brown stomach worm and black scholar worm challenges exist in discrete regions of higher rainfall and cool but not cold temperatures. In many instances, Haemonchus has become a multiple resistant parasite, so showing resistance to all classes of the USA available anthelmintics. Anthelmintics currently available in the USA are the clear drenches, yellow and white. The USA does not have FDA approval of Zolvix, StarTech, Clisantol. Each of those products has a novel drug chemistry, so different modes of action available. Next slide, please. In an effort to, if I could get the next slide, yeah, perfect, thanks. In an effort to combat resilience on anthelmintics in an effort to combat resilience, so as a standalone anthelmintics, as a parasite management tool, gain resistance in a hurry. So producers in the US are making diligent efforts to genetically select for parasite resistance through enrollment in the National Sheep Improvement Program. We're utilizing fecal egg counts to generate expected breeding values as a prediction of genetic resistance to parasites. Additionally, copper oxide wire particles, usually given in the form of a bolus, have been proven to be effective against Haemonchus contortus, not effective against other gastrointestinal nematodes. So just Haemonchus contortus. That's probably important to understand and know, and are gaining interest so these producers are gaining interest in this and adapting to using copper oxide wire boluses. Also proven in concept is the BT crystal, which is a bioinsecticide with strong anthelmintic properties. It's a pore-forming protein that attaches to and then disrupts the integrity of the parasite gut. So it's proven well, the BT crystal is proven well in concept, but we still need to develop a practical and economical method of administering it to sheep. Additionally, the US has WormX, which is the American Consortium for Small Ruminant Parasite Control. It's essentially a collection of it's a website with a collection of parasite related topics, where general management and information concepts can be found along with links to scholarly articles. So moving forward, USA producers need to recognize the importance of a multifaceted approach in combating the development of parasite resistance to anthelmintics that we have available here. Fecal egg testing on a regular basis is a key component of a monitoring program, and also need to know and understand what drenches. We need to do anthelmintic efficacy test more often. We need to know and understand what drenches are working on a farm by farm basis. It's also important to know and recognize that 90% of the parasites live outside the animal, so attention needs to be given to managing a refugia population in our pastures that are susceptible to our anthelmintic products. Bioworm is available, and that can help manage the parasites in the pastures. However, it's cost prohibitive for use at this time at a commercial level. And ultimately, the U.S. probably needs to look to engage more tools, gain access to more tools like the Carla test, which can be used to, similar to a fecal egg test, it can be used to select for genetic resistance to parasites. However, an IgA test or a Carla test has a greater heritability level than a fecal egg test. So it provides an opportunity for faster improvement and possibly could be used more widely on commercial farms. And again, if we could gain access to a product like Barbavax or gain FDA approval of new anthelmintics, so Zolvic, Startec, Placental, those would be tools to add to our toolbox that can be used in a multifaceted approach. Thank you.
I think you've got your cam on mute there, Jeff.
I wasn't saying anything important anyway. Thanks, Isaac. Up here in Canada, we do have a fairly limited selection of products, similar to the US, just simply put due to the size of our industry and a fairly onerous regulatory process that CFIA puts for new products. That said, we do what we can do. Coast to coast, there hasn't been a formal surveillance across all the provinces as for where resistance is, but there are studies here and there. One of the more ones that people refer to more fairly often, 35 out of 40 farms in the study in Ontario were experiencing drench failure with very high failure rates of ivermectin and febendazole. And the most alarming part of that study was that homuncus was extremely prevalent in the fecal egg counts post-drench. Where it's not formally documented like this case, it is fairly known anecdotally, and it is an issue that producers are aware of, as well as their vets, and they work very diligently with extension specialists and their vets to try to manage their way out of it. Double drenching and rotation of classes is fairly common practice in this country, and a lot of our efforts are to try to maintain efficacy and delay resistance as long as possible. So, given that we have a very small toolbox, we have to manage our way out of it. It helps that we do have a smaller flock size than many of our international counterparts, so we can manage it more intensively, relying on FAMACHA and fecal egg counts, as well as more intensively grazing to try to break that worm cycle to help us maintain our refugia, and really putting emphasis on biosecurity to make sure we don't bring in resistant genetics that we do not want in the farm. The industry in Canada is fairly diversified. You get more rangy pastures out west. In the east, where we're at, sheep tend to be into arable land that's often being cash cropped. When you have the right neighbor and the opportunity comes up, you can get access to cover crops, which are clean. Nothing kills worms like a plow will. And given that we have this little thing in Canada called winter that people might not know about, and it comes with snow, especially in the east, it is a reality that you will probably have to have some level of confinement infrastructure. Some producers have taken this to the next level for other management considerations other than just worms, but to bring everything indoors in total confinement and really try to offset that capital cost by production. That's one of the little quirks in agriculture. We just try to crank as much as we can because we know we are going to have a far higher cost basis than most people. When we raise them in confinement, it will eliminate worms. That said, for the large part, we're robbing Peter to pay Paul. We have other management considerations such as pneumonia and coccidiosis that we have to deal with, but there's a lot of overlap with those with the bovine industry, so we're in a far better situation to deal with those in some cases. As far as genetics, we do have some fairly good researchers that are working with the Carla test and have done a bit of work on it in Ontario, and they have found it to be fairly heritable with our genetics that we have, and it is being looked at very favorable as a tool for selecting replacement females right now. And at the end of the day, given that we are a small industry, we don't always see the need to reinvent the wheel. We're very willing to buy resistant genetics from other countries. Right now in my province, there's currently a program going on to bring in resistant genetics from New Zealand, actually, happening right now. And when all that stuff goes sideways, we do have a holy crap button called the emergency drug release. So basically how this works, it's a policy within CFIA that says if you get yourself a situation, none of the drugs on the market that are labeled for sheep or cattle or anything that's being used off labels in the Canadian market, we can bring in these products on an emergency basis if there's a sign off by a vet that there's no other viable option. So it is nice to know that we have that when we get our back against the wall. It's very rarely used, and rightly so. So this is where we're at and how we got here, and where we're going to go forward in this country. Within Canada, we are trying to work more on increased collaborations, both internationally and as well as nationally. Given our large geographical size, there is a fair degree of suffocation between the provinces, and we are currently working to create a national sheep extension group to try to break down some of these barriers. And we do have some fairly cutting-edge researchers that probably far above their weight, given the size of our sheep industry, that are working diligently with producers to try to come up with better management strategies and try to delay resistance as long as possible. And we do have a couple options. We do have a few options to try to bring some more products on the market when we need them. Tied to the emergency drug release, if we find ourselves coming back to the same problem, needing the same emergency drug release, that can be used to speed up the process of registration. I think if it has to be used so many times within 2 years, they will speed it right on. We do have some clauses for minor use species, so sheep and goats and anything else that oddball farmers would have, I guess. And I say that jokingly because in Canada you are a bit of an oddball farmer if you have sheep. There is a slightly quicker process for that, given that they know that it is a little too restrictive to go through the same protocols that a product for dairy cattle would have to go through. That said, if we do get some more tools in our toolbox, as Hamish pointed out, double action and triple action products are not going to be the answer. We do have to work diligently doing what we've been doing to try to delay resistance as long as possible. And I'll pass it over to Ed.
So in the UK, we've got quite a varied system. We've got about 90 different breeds that we're working with here, and people will be lambing those from a few people will lamb them in the autumn, and then lambing will really kick off through December and then out through to May and outside on grass. However, because it's quite varied, most sheep will actually be outside and lambs will be grazing outside at some stage, and that's when they kind of run into the parasite issues. So our main parasites will be the brown stomach worm and the scour worm, and they start to kind of accumulate in the pastures around April, May, and then build up through the summer and into the autumn. And then if we get a nice cold winter, it can vary a bit, it'll kill those. As we seeing a bit more kind of climatic changes in the UK, we're seeing a few more issues with homuncus, so barber's pole worm, spreading out from the southeast and heading north and west from there. In the UK, we tend to have single actives. So the kind of historic ones we've had access to are the groups, the white wormers, yellow wormers, and clear wormers. And as you can see from that chart there, we've kind of got varying degrees of resistance to all three groups there, with white wormers resistance being reported on kind of 94% of the farms in this report. So that's not particularly useful unless we're using it against nematodirus. We have two newer groups of anthelmintics. So you've got group 4, so your Zolvix. That came on the market in 2012. And we've already seen a little bit of resistance to that. And then we've had StarTech, which has had kind of varying supply issues, whether you had to get that through your vet. Then we had supply issues, and now that's available for the first time over the counter this year. So we tend to use those group 4 and 5s as a bit of a break dose when we get towards the end of the season to change that cycle. Awareness with farmers, there's a massive variation there as well. I think the people that are kind of aware of it are those people that are kind of quite keen for knowledge and a good oversight of the industry, but also those that have a problem with it. With most farmers agreeing that doing a regular effect test is important, but most people are only doing kind of less than 4 a year. So in the UK, we're doing a few things quite well, I think. And the first one of those is the animal health and welfare pathway. So this is a government-funded flock or herd review for your sheep or cattle. We need this for our farm assurance and red tractor to sell to kind of open more marketplaces for ourselves. And as part of this, we have to do a funded drench test. So that can be a fecal egg test, and then if worms are present, then a drench reduction test. So it's getting people engaged with the idea of doing and using reduction tests. The other thing about the UK industry is we've got SCOPS, which has been on the go for 20 years. So it shows kind of how long we've been dealing with this problem. And that's a collaborative industry body made up of levy payers, industry bodies, and also levy bodies, sorry, and vets as well. So that provides information to producers in varying formats. So webinars, podcasts, and fact sheets and case studies online. This advice is based on principles rather than kind of when and what to do. It's a lot more kind of dynamic, which does make it a little bit more complicated to follow, but it's a more sustainable practice on how to deal with parasites, and it's always changing. We have quite a lot of access to fecal egg tests, whether that be through your vets, local stores, or through the FEC pack I mentioned before. And in the UK, we've got EID, which means that if you've got electronic weigh scales, you can use targeted selective treatment, which is treating animals based on their weight gain. And we've got a little app for that now, which is first started in Morden research, and then Wormwise, I think it was not one, but an Irish company has Drench Smart or something like that, have developed this app. So what are the opportunities for the UK? I think the first is to get the farm. We've got a great bit of information out there and a lot of data to use and help there, but it's getting people to use that information and engage with that. It's not a one-size-fits-all approach with the current advice and what we're dealing with. No 2 years are the same, no two farms are the same, so it makes it quite complex in terms of dealing with that and actually applying that knowledge to your farm. We've got a registered list of advisors to help people kind of tailor that advice and what they've done before in kind of understanding that resistance and understanding how people can make the most of it. I think resistance is seen as quite a scary thing in the UK, and it's a lot better place to be in actually knowing you've got it earlier than waiting until it becomes a big issue and having to go or it presenting itself to you. We do have breeding for resistant parasite resistance in the UK in the forms of fecal egg count and IgA, which is measured in the blood serum. But we only have that in kind of 10 to 15 breeds, and we're gathering quite a lot of data on that through the Breed for Change project, which is ongoing. But because it's a limited number of breeds in our industry, the impact is pretty limited to the wider industry. But there's kind of a lot of enthusiasm within those breeds that are involved with it. As we heard before, we've got kind of integrated management with cattle and arable, but that does come with challenges. And then lamb nutrition and forage species, which we can kind of push on and learn from our kind of previous presentations. So I think watching this presentation, hopefully, and putting it together, we thought that there's kind of some quite common themes in terms of what we were coming across, what we were suggesting, and the solutions we're finding from each country. So the first step was to understand the situation on your farm and your property and your sheep. So that involves kind of knowing the resistance status of the animals you've got, what parasites are an issue and what time of year they're an issue, and what resistance status those are as well, and not buying it in. The next step, once you know what's going on your farm, is to go where to look for that information and that advice. So we've got the kind of Wormwise SCOPS in the UK and New Zealand, but we've also got the American options. But because this information is quite dynamic and it's more principle based, I think this would be a great area this forum would be a great area to share that advice and knowledge that we've tried on our farms and had our successes and failures, because that's the best way we can learn, I think, from applying that knowledge. And then the third and final pillar of kind of the parasite control is those non-drug options. So to help prolong the chemicals we've got, so that'd be genetics, grazing management, integrating those other things to help prop up those drugs, delay resistance in our flocks. And then if any new drugs do get market access or are developed, that shows that we're a responsible industry in using those. And yeah, I think that's. Any questions, please?